So basically, this is what the FDA has determined is safe for the issuance of the COVID-19 vaccine, specifically the Pfizer BioNTech vaccine and upcoming soon the Moderna vaccine. And really, what they've determined is that the potential benefits are likely to outweigh any potential risks, and there's no alternatives. And there is a statutory criteria that the vaccines have had to meet in order to receive this emergency use authorization. And both of them have exceeded the statutory criteria thresholds, which required a 50% efficacy, no serious safety concerns. They're looking at 95% efficacy and no serious safety concerns. For any reason, the safety and efficacy changes as it is rolled out among the American population, the FDA can revise or revoke it at any time.
So let's say somebody has health issues later on, and there's a large group of people, and they all have one thing in common, and it's that they got this vaccine. Who would be on the hook? Is that the federal government?
Well, the federal government has what we have passed called the PrEP Act. It stands for the Preparedness Emergency Readiness Act. And underneath that, there is a compensation program. This one would be called the Countermeasures Compensation Injury Program, where individuals that received a vaccine for up to a year can file a claim and then potentially receive any type of loss of income, reimbursement for medical expenses, whatever it might be. And so that's how the government has tried to assure people that should there be an adverse reaction, there is this compensation fund available. And the reason why it's called countermeasures is because it's not a routine vaccination. It falls under what we're in right now in a state of public health emergency.
Dr. Carmona, people are wondering, okay, frontline workers will go first, but then after that, do I call my doctor? Do I go to a drugstore? How exactly will this roll out in the community?
As these vaccines come into the state has a plan of how they're distributed. The metropolitan areas are relatively simple because you can have a lot of people in that area. You have freezer farms there. But once you get into the rural areas where we have a lot in Arizona, that's the challenge, being able to get those vaccines to the people. So for now, each state has a plan that describes how they're going to allocate those vaccines, setting up sites. In the beginning, there will be places like in Tucson Medical Center and Banner are the first two sites. As more vaccines come in, I expect we'll see CVS, Walgreens, clinics, doctors' offices, but that's later as the robustness of the supply chain increases.
We've already heard that there are frontline workers who have said, I will not get the vaccine. As we know, it's voluntary at this point. How do you see that playing out here in a community of this size where the cases continue to grow?
I think we have a responsibility to be transparent and be able to educate the public as to the safety and efficacy of the vaccine. Right now, there is a lot of division uh, politically as well as scientifically, where people are confused because they get mixed messages. Where we would like leadership to be able to be promulgating the best science forward. We have conspiracy theorists popping up. We have people who are denying the value of vaccines. And quite frankly, in the history of the world, vaccines are arguably maybe the most important advance in science. We don't have polio anymore, for instance, and other diseases. So it's important that the public gains confidence in the system that has been put in place for their benefit so that they can make informed decisions. And myself, I will get the vaccine. My family will. When I was Surgeon General, this came up once again on another issue, and I went on TV nationally, got a vaccine, spoke about how my family's getting the vaccine. I think the public has to become comfortable with the fact that the science is very strongly in favor of everyone getting vaccinated so we can accelerate herd immunity and have no place for the virus to go.
I do think, if I could add, I do think it's quite promising that the polls seem to start to be upticking with more people as the vaccine's rolling out, wanting to take it whenever it's their turn in the priority group. And I think so. I think as that number, I've seen as high as 63% now. But then that remaining 30%, those aren't individuals who are saying no, I don't want the vaccine. A lot of those are individuals that are taking more of a wait and see approach.
Who ultimately is going to have the final say on this? Let's say you get a frontline worker who does not want to get the vaccine. Maybe a school says we want to require it. I mean, is that when the state comes in?
The state does have police power. It has the ability to protect the public health and welfare of its residents. Uh, there are, as you know, like schools do have policies with vaccinations where they're mandated for a child to attend school. Similar with hospitals or healthcare settings, they have similar mandates. If you're going to work in that setting, you have to be vaccinated. The difference here, however, is that this is not a fully approved medical product vaccination. It's not widely available. I think to call for a mandate at this point in time is right. It's too early to go down that line of thought, but that is something that could potentially be on the table. And of course, there are exemptions to it, both for medical or religious reasons.
It's something that I was challenged with a lot when I was Surgeon General, and today even in policy here, is that in a democracy, all of these issues that are so controversial a lot of times come down to the right of the individual versus the collective right of society. And the issue, well, I don't want the vaccine, but you're not taking the vaccine contributes to the virus being out there longer, and if thousands of people don't do it, we don't achieve herd immunity. And I think, as beautiful as our democracy is, sometimes it becomes a challenge when we're trying to accommodate for the rights of an individual and the collective rights of society. And I think that's where we are now with this vaccine.
We heard Governor Ducey say that teachers in Arizona would be among the first, but frontline workers. And then that begs the question, who can say, well, wait a minute, I think I deserve it too, based on what I do or who I interact with?
Right. I think that is happening in Arizona. I think that's a reality of what's happening across the country. It is just take a little step back. It is interesting to see how the vaccines were initially allocated. Right. They were done based off each state's population. You get this many vaccines. But one could easily argue, as states are beginning to argue and others, that should be a more targeted approach. Like states that have a stronger segment of their population of older adults, maybe they should get more of the vaccine right away. You are going to see these heated battles for who should be first in line. And I think the way to do that is just as methodically and transparent as possible, working your way through. But different states are going to do different things. We're seeing that right now. It's been really interesting how different states are handling the prison population. So, for example, Massachusetts put prisoners at the top of their 1A. They're going to receive the vaccine along with long-term care residents and healthcare workers, where other states have explicitly not made that decision. The most important part is just to be clear about what's happening um, as early on as possible, and not to have it all come down to one individual person, like the governor saying it has to be this way, but to get this ultimate buy-in between many organizations and groups across the state for what could be best to get the ultimate uptake of those willing to take the vaccine.
Okay, any concern with Pfizer is first, then Moderna? They both have very high efficacy rates. Once those resources are depleted, there will be other drug makers. Is that what is left for whoever didn't get the first batch?
I think it's great that our country already has two vaccines, and we may see others that are going to come into the pipeline. So, as far as anybody being worried about, I'd rather have the Pfizer or the Moderna, I would say look at them equivalently. Get the one that's available in your community as quickly as you can, based on the guidelines that your community has set up for distribution of the vaccine.
All right, Dr. Carmona, we are entering into another holiday here. You talked about leadership and messaging. We are seeing leaders who are taking photos with people. They're wearing masks. As we head into the holidays here, what is your message about being sure that we try to minimize the spread as quickly as possible?
I think what's important, and I think you hit on a real important issue here, Lorraine, is that our leaders should be emulating the very behavior that we want to be seen in public. And often we see political leaders in big meetings with no masks and hugging and exchanging information. And so that gives doubt to the public. Well, why are they telling me to wear a mask? Why are they telling me I can't see my family? We all need to come together fighting this war against COVID, because it affects Democrats, Republicans, independents, old, young. It doesn't make a difference. We're all vulnerable. I would plead to our elected officials to put down the partisanship and emulate the behavior that you want your constituents to express to be able to decrease transmissibility of this very deadly disease.
All right, Dr. Richard Carmona and Professor Tara Sklar, my thanks to both of you.
Thank you.
Thank you so much.